So friends, in this video we will discuss the histology of the gastrointestinal tract, and this is very important for your PG entrance exam. So this is our gastrointestinal tract. This one is the upper end of the esophagus and this one is our anus. Now our gastrointestinal tract is a tube-like structure which is hollow in the central area, and this hollow space is called lumen of the gastrointestinal tract, and this lumen is surrounded by mainly four basic layers, and these are four basic layers of the gastrointestinal tract. The innermost layer, which is present towards the luminal side, is called it called mucosa, and outside mucosa this one is the submucosa, and outside submucosa this one is a large smooth muscle layer is present, and that is called muscularis externa. Muscularis externa, and outside the muscularis externa this one is the outermost layer called either serosa or it may be tunica adventitia. Tunica adventitia. Now the mucosa itself consists of three layers, and the muscularis externa consists of how many layers? Two layers. The innermost layer of the mucosa is a cellular layer, and this is called epithelium. Outside the epithelium this one is a very thin layer of loose areolar connective tissue is present, and this is called lamina propria. Lamina propria. And outside the lamina propria this one is a very thin layer of smooth muscle is present, and that is muscularis mucosae. So these three layers together form mucosa. Now outside the mucosa this one is a very large layer of dense irregular connective tissue is present, and that is called submucosa, and this one is the inner layer of the muscularis externa, and this one is the outer layer of the muscularis externa. Now the inner layer of the muscularis externa has muscle fibers which are arranged circularly. It means the inner layer of the muscularis externa has circular smooth muscle fibers, while outer layer has longitudinal smooth muscle fibers. Now how will you remember that the inner layer of the muscularis externa has circular smooth muscle fibers? It is very simple, as the shape of the lumen is, lumen का शेप कैसा होता है? lumen का शेप होता है सर्कुलर, और जो इनर लेयर है एक्स मस्कुलरिस एक्सटर्ना की, दैट इज मोर टुवर्ड्स द ल्यूमेन. अब क्या होता है, ये जो ल्यूमेन के शेप का जो इफेक्ट है वो किसके ऊपर पड़ेगा? सबसे पहले पड़ेगा किसके ऊपर? इनर लेयर ऑफ द मस्कुलरिस एक्सटर्ना, और इसके शेप का इफेक्ट पड़ता है इनर लेयर के ऊपर. तो इनर लेयर के जो मसल फाइबर्स होते हैं, स्मूथ मसल फाइबर्स, वो कैसे हो जाते हैं? वो हो जाते हैं सर्कुलर स्मूथ muscle fibers. So in this way you can remember that the inner layer of the muscularis externa contains circular smooth muscle fibers. So obviously the outer layer will have longitudinal smooth muscle fibers. So these two layers together forms muscularis externa. Now coming to the outermost layer of the gastrointestinal tract, and that is either serosa or tunica adventitia. So first layer is the mucosa, which has three layers. Innermost layer epithelium, outside this there is lamina propria, and outermost muscularis mucosa. And the second layer is the submucosa, third layer is the muscularis externa, and the fourth layer and the outermost layer is the serosa or tunica adventitia. Now these four basic layers of the gastrointestinal tract undergo some specific variations or changes in specific parts of the gastrointestinal tract, and these specific variations are very important for your PG entrance exam, बिकॉज जो अनयूजुअल थिंग्स होती हैं, जो स्पेशल चीज़ होती हैं, जो मॉडिफाइड चीज़ें होती हैं, दैट आर वेरी इंपॉर्टेंट फॉर द MCQs पॉइंट ऑफ व्यू. तो आगे हम क्या डिस्कस करने वाले हैं, व्हाट आर दीज स्पेसिफिक वेरिएशंस और चेंजेस इन दीज फोर बेसिक लेयर्स ऑफ द गैस्ट्रोइंटेस्टाइनल ट्रैक्ट.